This has been a great day, an incredible day of learning for all of us at the ILC. On this, the 10th anniversary of hosting the Canadian Ehlers-Danlos Syndromes Conference. Thank you to all the presenters for your valuable time, especially on a weekend, and for your gracious contributions to our event today. Our deepest gratitude goes to the doctors and healthcare professionals who attended and helped to make our conference a successful event. We greatly appreciate the opportunity to work with McMaster University, and although we didn't achieve accreditation this year, we're looking forward to developing this partnership for CME approval in 2024. As we've stated before, the ILC's mission is to stay connected on research updates that can help drive improved clinical care pathways. Our partnerships with academic experts provide opportunities for advocacy dialogues with government representatives on how they set their budgets and write policies for healthcare delivery. Over the past decade, this annual conference has provided the opportunity for the ILC community to connect and share experiences, and along with medical knowledge, have helped broaden the comprehension of the Ehlers-Danlos Syndromes, heritable connective tissue disorders, and chronic pain. And in turn has expedited some changes in this critical area of healthcare, but not near enough for the proper care pathways for this patient population. The key points from this conference will promote deeper thinking and invigorate our planning committee's work for the future. Please help us in improving by sharing your ideas, and help us also evaluate and summarize the themes we can impart from this conference. First, I think the conference has been very effective in meeting its purpose, which is to recognize and identify the multiple comorbidities associated with EDS, hypermobility spectrums, with coexistent conditions of dysautonomia, chronic pain, CCI, AAI, and POTS, mast cell activation, SFPN, MALS, ANS, CEMS, Chiari malformation, neurological complications, GI manifestations, and related symptoms such as headaches, suboptical pain, altered vision, hearing problems, dizziness, balance issues, urological issues, muscle problems, hematology, and allergies, to better understand the unique needs of individuals with these conditions. So compassion and empathy are prioritized for tailorizing healthcare delivery, leading to the development of improved patient and physician partnerships, and thus improving our quality of life. To describe the best evidence-informed approach for managing the long-term multisystemic manifestations in Ehlers-Danlos syndromes, HSD, and the many comorbidities mentioned above, so patients can live well with these chronic conditions. To empower patients in their healthcare journey by creating a detailed document of their unique needs to share with their healthcare providers. And on your screen has about our wellness sessions. We strongly encourage, if you need help, we're there for you, peers and occupational therapy students. Secondly, following these themes for discussion, there were several important and interesting points raised. Dr. Raj shared the importance of proper diagnosis concerning POTS and the relevance of receiving a POTS plus diagnosis in individuals, particularly women, with multiple comorbidities like HEDS and HSD, ME, to name a few. And these people are 5 times more likely to also have MCAS than those without HEDS and comorbidities. He highlighted a recent study of EDS and POTS versus POTS only patients, and there are longer diagnostic delays, challenges, and a younger onset. As with our speakers, Dr. Raj discussed pharmacological and non-pharmacological treatments for POTS, reinforcing that the condition is chronic with no cure, but can be treated and managed for a better quality of life. Dr. Francomano's presentation today highlighted the complexity of EDS and HSD and how they affect various organ systems. She shared that the primary focus of managing musculoskeletal symptoms involves muscle relaxation and physical and aquatic therapy, which will benefit joint laxity. She described different methods for pain management and how to manage cardiovascular symptoms, hypertension, and other related syndromes. Dr. Francomano believes, as our other presenters will agree, that understanding and the underlying causes of symptoms and tailoring treatments based on the individual's condition, along with regular exercise and coping strategies, is the key to managing EDS and HSD. Dr. Bluestein's presentation highlighted how an integrated approach for treating hypermobility is best practice and will ensure preventative health. She describes the challenges with this diagnosis and shared the flexibility, concerns, symptoms, and treatment. We couldn't agree more with Dr. Bluestein that individuals must documentate their unique challenges and empower themselves so they can direct their care and educate their healthcare professionals in respect to the partnerships to live well. We heard from Dr. Yelman, who presented on the many comorbidities of EDS patients and shared interesting overlapping symptoms. The fact that nearly 1 in 3 patients with MCAS had a diagnosis of HEDS in a large patient sample is a striking statistic, highlighting the need for a better understanding of the overlap of these conditions. Sorry, my MCAS is kicking in. Concerning CCI and AAI, upright imaging is preferable over supine imaging, and it is challenging to find experienced professionals to aid in imaging, diagnosis, management, and treatment of these conditions. He explained that surgical interventions are the last resort, but are sometimes warranted. When reviewing small fiber polyneuropathy, he shared that both qualitative sensory testing and skin biopsy evaluations have indicated a high incidence in hypermobile EDS patients. Concerning males, it is most often occurs in females in their 4th decade of life. There is a possible pathopsychological relationship, physiological relationship, in patients with POTS and or hypermobile EDS, and surgical treatment has a 70 to 80% success rate in reducing abdominal pain. Lastly, he highlighted that a key diagnostic criteria for ME and CFS is the presence of post-external malaise, or PEM. Our final speaker today, Dr. Bluestein, highlighted understanding the association with dysautonomia, HSD, and MCAS as a triad of migraine comorbidities commonly seen in clinical practice, all 3 of which need to be diagnosed and treated to achieve any degree of effective migraine management. She shared that the autonomic neuropathy is a dysfunction of the peripheral autonomic nerves and how it differs from dysautonomia. She shared critical information on POTS and its symptoms, not just vital signs, but most disabling and treatment-resistant symptoms are fatigue, dizziness, cognitive dysfunction, brain fog, and comorbid conditions such as migraine, neuropathic pain, insomnia, and joint pain, all of which are prevalent in hypermobility spectrum disorder as well as hypermobile EDS and should be treated. She shared that EDS as a comorbid condition is missed by many pain and headache clinics practitioners and discussed the many neurological manifestations of EDS. We thank today's speakers for collaborating and connecting to increase and mobilize the knowledge to motivate further research for the best health outcomes for this community. We recognize how the ILC impacts healthcare providers by sharing essential knowledge and offering this educational event where patients connect with clinicians. We hope to provide an in-person event in 2024 and prioritize engaging more doctors' participation with a view to knowledge translation and, more importantly, mobilization. We thank you again sincerely for the work that you're doing and for sharing it with us today. We will contact our presenters for any unanswered questions today and follow up with responses soon. Please complete our evaluation form, which is also in the comments under my initials TS, or the QR code from the slide deck if you took a picture of it. It will bring you to the evaluation page. We really value your feedback. I want to convey a special thanks to everyone on the planning committee, our presenters, and Lenore with Sweet Lemon Productions. All have been extremely helpful in planning and executing our 2023 conference series events, including our successful Women's Health webinar in April and fitting the pieces together and the 10% rural webinar in June. It has been extremely productive and busy year, only made possible by your continued support. The ILC has no government funding. All we do is based on the donations from patients like you and from the medical community and sponsors that see the value of the work that we are doing. As we celebrate and recognize Dysautonomia Month and the start of National Pain Awareness Week from November 5th, tomorrow, to the 11th here in Canada, the ILC wishes you a restful and a pain-lessened evening, and we look forward to sharing our 2024 educational series events with everyone in the next few weeks. And don't forget about our peer support, our wellness sessions, and our support group that's available. Links are on our website that you can click on. We're here to support you throughout the year beyond today. Thank you. Merci, McWitch. Have a great evening.